Imagine a medical treatment that can knock out severe pain, almost instantly. And not with a pill, but with just a few tiny needles. In the ear. Sounds a little like science fiction, right? Well, it's a very real technique, and it was developed for one of the most demanding environments you can imagine. Today, we're going to break down Battlefield Acupuncture, a surprisingly simple yet incredibly powerful way to manage pain.
You know, to really get a feel for how big a deal this is, let's not start with the technical stuff. Let's start with a story, a single case that just perfectly shows what this thing can do.
So, this quote, it's about a 68-year-old woman named Mrs. Moss. And when she came into the clinic, she was in bad shape. She was having a flare-up of chronic back pain so severe, she rated it a 10 out of 10. I mean, she was basically crippled by it.
Okay, let's just process that for a second. A perfect 10 on the pain scale, down to a 0, instantly, all from just 2 tiny needles placed in her ear. I mean, a result like that is so wild, it just makes you ask, how on earth is that even possible? And to answer that, we have to look at where this technique actually came from.
See, Battlefield Acupuncture wasn't dreamed up in some quiet, comfortable research lab. Nope, it was born out of pure necessity. It was a direct answer to one of the biggest medical problems facing the modern military.
For years, the military has been desperately searching for better ways to handle pain. I mean, think about it. Whether it's a sudden injury in the field or the chronic pain that so many service members deal with afterwards, the go-to solution has often been medication. And that reliance on opioids, well, that's become a huge concern.
And we're not talking about a small problem here. This is massive. A full 20%, that's 1 in every 5 service members, reported using prescription painkillers. So you can see why there was this urgent push to find alternatives that were effective, but also fast, portable, and crucially, not addictive.
And this is where the story takes a turn. Right out of that critical need, a really clever, streamlined solution started to emerge. Something that could be used quickly and effectively, even in the middle of chaos.
So what is it? The official name is Battlefield Acupuncture, or BFA for short. And what it is a very specific protocol for ear acupuncture, or auricular acupuncture, that was designed from the ground up for one thing: killing pain fast when time is absolutely critical.
Now, here's the really cool part. The basic idea of mapping the body onto the ear, that's been around for a while. A French doctor systematized it way back in 1957. But the breakthrough came in 2001. A U.S. Air Force physician, Dr. Richard Niemtzow, took this big, complex system and boiled it down to a simple, easy-to-learn recipe using just 5 key points. And that became the Battlefield Acupuncture we know today.
So, what is this 5-point recipe? How does it actually work? Let's get into the nitty-gritty of the protocol itself. Okay, so the protocol uses up to 5 very specific points on the ear. They are the cingulate gyrus, thalamus, omega-2, point 0, and shenmen. And to make this recipe super easy to remember, especially in a high-stress situation, practitioners just use the acronym CTOPS. Simple, right?
And these are not just random spots. Not at all. Each one is thought to have a specific job. For example, the thalamus point, that's aimed at what some call the grand central station of your nervous system. It's a major hub for all incoming pain signals. And the shenmen point, that's like flipping a parasympathetic switch, basically telling your whole nervous system to just calm down. Together, they create this really powerful pain-blocking effect.
So we've got an amazing story, and we have a clear, simple protocol. But you know how it is in medicine. That's not enough. You need the hard evidence. So how does this hold up when you take it from one patient and put it into a rigorous scientific trial?
Well, that proof came in 2018 with a really important study. Researchers ran a randomized controlled trial, which is pretty much the gold standard for medical research, on 45 military members who had both chronic pain and insomnia. They split them up. One group got the BFA treatment, and the other just continued with their usual care.
And the results, well, they were pretty striking. You can see it right here on the chart. The group that got the acupuncture had a significant drop in their pain severity scores compared to the group that didn't. There it is, in the data. It wasn't just a fluke. It actually worked.
And you know, the benefits went way beyond just a number on a pain chart. The folks in the BFA group said that their pain was interfering less with their actual lives. They were sleeping better, they were enjoying life more, all the things that chronic pain just steals from you.
So this all brings us to the big picture, right? We have this technique that was born out of military necessity, it's got a super simple protocol, and now it has real scientific research backing it up. So, what could this mean for the future of how we all treat pain?
When you really boil it down, the advantages are pretty clear. It's incredibly fast-acting, it's a non-opioid, which is huge, it's so versatile you can do it almost anywhere, and it's backed by solid evidence. I mean, it really checks all the boxes for what we're looking for in modern pain management.
Which leaves us with this one big, thought-provoking question. We started this whole thing with the story of Mrs. Moss, one person whose life was changed in a single moment. But as this technique starts to move from military bases into mainstream clinics, you just have to wonder, could this simple, 5-point plan born on the battlefield actually change the way we all think about and treat pain for good?